I became a pain in the neck over this, and with Wendy's support, got involved in improving children and young people's health outcomes, which was requested by the Secretary of State. And basically, we have the worst mortality rate for children under 14 in Western Europe. It is absolutely shocking. Good old UK, good old England, the good old empire, we have the worst rate. Obesity, diabetes, asthma. And you won't be surprised to hear it's those most disadvantaged children. So those children who are deprived, looked after children, those involved with the criminal justice system, children with disabilities. Quite shocking. So it's not just we, us, it's we who are looking at improving children and young people's health outcomes. I'm managed with a lot of agitation to get myself now representing school nursing. I was very concerned that there didn't appear to be anyone representing school nursing and that huge public health component 5 to 19. So I'm trying to do us all justice by going to quarterly meetings now with the forum, which is very interesting. As I said, I've kind of pulled together what I've seen UK-wide, but mainly England-wide. And these are examples where I have seen development in school nursing services. You'll note I didn't say the word increase in resources. I said development, but what it has led to is increased capacity. Some areas have invested and commissioned additional school nurses or some of the school workforce. Many areas haven't, but we have had released capacity. We need very clear service specifications. Going back to what Wendy said about core offers, we need to agree those with our commissioners. We need to negotiate them with our commissioners. And we need to be measured and held to account against those service specifications. They are the bane of my flipping life. As a consultant nurse for looked after children, I'm intimate with my commissioners. Intimate. I see them on a 4-weekly basis, and I report to them every week. Every week. They don't apologise for it, and I don't apologise for it, because actually what I have seen is a massive increase in the quality and the health outcomes of looked after children in Leeds, and I can evidence that to anybody who wants to have a look at it. And that is because we've had very clear service specifications. I and my staff have told me when we've got gaps in service provision that we cannot fulfil. We have evidenced that and said, this is the gap, this is what we cannot do. What do you want us to do about it? And I'll go on to tell you a few things that have happened. And actually, we have had more money, but it's not always about money. It's also about what you don't have to do. And I had things taken out of my service specification that were not my job. My mum always said to me, if you can't get to it or through it, go around it. Would you allow a school nurse to come and talk directly to you, Mrs. Commissioner? Would you? Yep. I'm not telling you to cause difficulties for yourselves, but to my mind, if you are passionate about children and young people and you can evidence gaps and you have a commissioning issue, and we have many areas in the country, sadly, where we have poor management still. And that I had, in my own career, I had 5 years of a barrier that led to me moving this side and going that way to the issue, getting the result, and the manager learning maybe from that. And that sounds really arrogant, doesn't it, for me to say, but I was a Band 6 school nurse when I did that. So I think there are other routes that we need to use, and commissioners right now, and particularly the local authority, and Wendy's just touched on this, very keen to hear, need to know, want to learn. I have made it my business to meet with all my CCG lead nurses before they've even started properly. Because actually, if I go tell them about looked after children and young people in my city, they've got a massive job. They've got all children and young people on their agenda. I need them to know about my children and young people. So I made it my business to find out who they were and hunt them down. I've now hunted them all down, and we had coffee and cakes, and we talked about looked after children and young people. Not easy, but it can be done. It's not all safeguarding, NCMP and HPV. Who disagrees with me? Go on. Do you disagree? Is that how it feels? Is that how it feels? Yeah. A commissioner was speaking to me yesterday about the role of school nurses in safeguarding, and we worked really, really hard on a lovely pathway, didn't we, Wendy? If you're not familiar with the SAPHNA website, we've got a stand outside, and I'll show you. But all of the DH work is on the SAPHNA website behind the DH button. Seemed like a sensible place to put it. But one of the crucial pathways to my mind was around safeguarding. And what I think that pathway very clearly says is what the school nurse's role is, but much more importantly, what it isn't. Would you agree, Wendy? And I think you there have a tool to go and ask those questions. The commissioner I spoke to yesterday is just coming into post to be a commissioner for school nursing. And I said to her, well, what's happening out there is actually every school nurses have to go to every ICPC, Initial Child Protection Conference, every one, and to a review. And actually, it's unethical and immoral because actually they're not out there fulfilling any part of the plan, and they may not even see the child and be involved for 2 years. Does that sound familiar? And she said to me, why? Why on earth would you spend all that money sending a qualified school nurse to a child protection conference when they've not got a role to play? We need many more commissioners like that, do we not? Do all the children and young people in your schools know how to contact you? Again, watch out for the posters, but it's about thinking how we do that. Wendy talked about we must listen and be guided by the children and young people. This is actually in all frameworks, actually, and we need to evidence this very clearly. Do your child health records prompt you to ask the views of the child? Because there's no point delivering services that don't meet the needs of the kids because they won't come back. Do you ask about service satisfaction? I remember somebody saying this to me 15 years ago, and I said, I can't be busy asking them if they're satisfied when I'm busy doing. And it was only when a young person told me what he really thought of what I was trying to do that I thought, actually, I should have asked you. Have you had any training in listening to children? I can remember talking to a young person, in fact, 3 young people who were cause for concern family. I was 6 weeks into my job and I didn't know how to talk to them, so I was really condescending. When I look back, we just made it up. I did. I was a qualified nurse. I had communication skills. I was a qualified midwife. Would you agree, Penny? We had our own indomitable style, of course, but actually we were not trained in listening and communicating. So if they tell you your service is naff, or they don't know who you are, or actually they want to see you weekly, or they weren't very happy with you, what do you do with it? Do you collect it? Do you evidence it and use it as evidence? It's one of the most powerful tools I have seen recently in school health services, is the voice of children. I don't know if other people are aware of that, but I was looking for some additional funding to develop a peer education programme around child sexual exploitation. So I wanted to work with exploited young people to teach other exploited young people who were looked after. And I got the young people to tell me why they felt that was necessary. I'd been trying for 3 years. I collated the evidence and it was done deal in 15 minutes. It was just incredible, really. And another reason why I'd been wasting my time. So I've wasted a lot of the public's money and the government's money. But there's not enough of us. Again, we know this, but prompt recruitment to vacancies and retaining staff is absolutely vital. And you were telling me you can't recruit to your vacancies, and Wendy was outlining the wonderful work we've done, not with the young people, but if you go onto NHS Careers, there are 2 or 3 wonderful videos of school nurses right now telling others about what school nurses is. You need to use them. They're going to be linked to our website soon as well. Really good. Male school nurse in there as well. saying what it is we are, what it is we do, and why it's a great job to have. On our website, there's the DH button, and inside it says Have Your Say. And I was doing a count up last night, and we've had over 3,000 responses from school and public health nurses that have actually helped shape the Department of Health programme. It's a Have Your Say button. If you hadn't had your say, do. Now, clearly, the programme cannot fulfil all your needs, but it's been shaped by you, because if it's not shaped by you, it doesn't work. Wendy can write all she likes, can't you? You can come up with all kinds of things, but actually, if it doesn't work in practice, it doesn't work in practice, and we've had some really, really valuable stuff come through there. School nurses must embrace leadership and become business savvy. I wasn't taught how to run a business. I wasn't taught how to make efficiency savings and SIPs, cost efficiencies. I've got to do a 22.3% SIP. I'm a nurse. I am a nurse, okay, but I have to evidence. We had a stationery amnesty. I didn't have a black pen. I'm not kidding you. I didn't have a black pen. I bought a packet of pens from the pound shop to give to my team. We saved £814 in 1 month. Shocking, isn't it? Shocking. I won't tell you about the toilet roll, that's another conversation. Get political. And one of the other main levers, and we've had a couple of really good pockets of successes with parent power. Wendy involved not only the British Youth Council, but also net mums and dads. Extremely influential group of parents in this country. Okay, they were driven by the health visitor agenda, but we'll forgive them because the kids grow up, okay? So, net mums, massively influential in the increase in health visiting in this country. I'm going to stop there, or else I might get my head chopped off. But we need to use our parents. If parents have got health concerns and they come together as a collaborative, they can be extremely powerful and influential. If you have a concern about your school populations and school communities, go and talk to your parents and governors. Get them on your side. They are better on your side than off your side.